So we shall just ask our volunteer to come forward. Admittedly, we're not on a bed lying prone. We're just utilising this to show the actual fitting and strapping that would be utilised within this and the features of the brace. So we will just get Rob to hold the brace for me while I work this up. Clearly the patient would be, once adjusted, be on a bed position with this shell posterior to him, and the anterior shell would be added on a bed situation. So for demonstrations purposes, we're just fitting this. There is 2 chest straps, 2 shoulder straps, 2 chin straps, and as you'll see from the posterior of this here, an adjustable optional brow strap, which would eventually come around the brow in this section here. So we'll just fit this over to Rob here. We can just start to fit the straps up. The straps can all be cut to length and adjusted as well. So you can trim all this down. Once you've actually got the sizing that you want from the strap, there's a very generous strapping arrangement with the brace, with pre-built pads onto the brace itself. But as you can see, the strap length is enormous, and that would allow for quite a girth for the patient to fit into the brace itself. There's no issue. So you can see from this, if I turn Rob slightly to the side, if he rotates and lifts his elbow up, little wing, you can see that we're locking back here, but actually we've got yet another foot of strap. So there's buckets of strap for the larger patient to fit into the brace. Okay, Rob? Yeah. That's good. So next we go over to the shoulder straps. Equally, the same situation arises, and it's simply to allow for one multi-use size on many size patients. So frontal shell on, you can let go now, Rob. Chin in neutral, we're after there, looking into pea size. And we've got the shoulder straps in place, we've got the chest straps in place. We go for the chin support straps here.
Bad. I'm able to, side for one first, Rob.
There's an open tracheal area for ease of access, if need be, for any reason, for cervical work to go on. If anything, sometimes they'd have to fit tubes and do work in here, but it's a very nice clear airflow. As you'll see from the AP position, there's great clearance there, but loads of support at that point also. Lastly, but not leastly, this is an optional extra, and this would be a brow strap to go on, just if the patient felt they wanted more support still, or if they were not super compliant and you wanted to actually pin them a little bit more. Normally that's rarely used, to be fair, but it's a nice option to have just in case, because different practitioners, quite frankly, would want different features from the brace, and they would always use this, some would never use it. So that would be the situation of that brace. The brace, reason for the liner is you'd be wearing this with cervical injuries, trauma to the sort of the level, as I said, of C2, T3 level here. So we're looking from the camera point of view to let you know roughly where we are in the ballpark. Axilla level would be T6. So if you go armpit level, that's T6. That's where you know you wear are. This is stating in the catalogue T2. I actually feel it'd actually be quite useful for somewhat lower down as well, because we're at, as you can see, T6 here. We're very well covered by the brace at that level, because a lot of bracing is going and stating T6 downwards and not wanting to get involved in slightly higher. So there's a bit of a gap in the area of T2 to T6, and I think this would very well comfortably look after that area. But I think it's a plain safe with the consultants on what level you can control. But very often when I'm with the different departments, physiotherapists, occupational therapists and consultants that fit these, they would often be saying, surely you can go lower than the T2, that looks nice for T3, T4. And I say, yes, I think so too. But it's not going to be for use of this brace, a stable fracture in that it can't be a displaced fracture. It's very useful in controlling anything. Obviously, it works for trapped nerves, even for they use them often for whiplash injuries, that sort of thing as well. So you get whiplash injuries where you've got neck injuries, any sort of injury to the neck where they're concerned. This brace can go on for that level and control the head. It's a very good rotational control, anterior, posterior control, lateral control, forward flexion, and rotational control for the head. So it's an AP, anterior, posterior, lateral control, forward flexion and rotational control brace. So it literally locks that up. Now there is a version of this brace with the extra non-invasive halo that fits around the head in a circle on here. I can perhaps show you the picture of that just from that point. Another addition is the upper halo that fits on to the brace as well. But that would be extreme levels of care required from that. This often is enough to deal with most things at that higher level.